Thank you for joining me at the Envita whiteboard, cardiovascular disease, as we talk about high blood pressure, which is common. People have hypertension, and typically they talk about 120/80 being the healthy blood pressure numbers. People have elevated blood pressure, which leads to medications, and then they can feel like they can never get off. Let me tell you what we have found that is extremely exciting and how you can lower your blood pressure naturally. That's right, lower it. Number one, we're going to talk about factors that affect high blood pressure. Okay, we know that there are things called primary factors and secondary factors. Basically, primary factors in the traditional world of medicine is we don't know what's going on. It's unknown reason for blood pressure, okay, being increased. So we're going to take a look here at our blood vessel wall again. And I want to tell you why blood pressure is so important. So we have that clot and that blockage here. You get under stress, blood pressure increases because your blood vessel walls are inflamed. You have high C-reactive protein and you don't know it, which means you have high inflammation. You have a weak immune system that's playing a factor in infections along the blood vessel wall. You have low antioxidant levels. You also have going on a plaque in progress because your blood vessels have fibrin building up along the side, so on and on. High bad cholesterol like LDL and triglycerides, and then all of a sudden the blood pressure increases, and this plaque breaks off and goes to the brain, causes a stroke, or goes to the heart and causes a heart attack. Or this clot can be located in your leg and go up into the area of the pulmonary respiratory system as well. So what we want to show you is that blood pressure plays a very critical role. So we don't know what the cause of primary unknown high blood pressure is. Secondary can be caused by having kidney problems or function in circulation getting to the kidneys. And so the kidney problems can cause a problem with high blood pressure as well. But now we have a natural way to deal with blood pressure. So I'm going to show you that we have found that breathing, that's right, breathing can affect something called the baroreceptor in the blood vessel wall that can reset the tension in the blood vessel wall. So here's what we're going to do. We're going to have our blood vessel wall again. I want you to see this blood vessel, okay? So here's a blood vessel. And I want you to realize that the blood vessel is made of muscles. So these are all muscles. The intimal lining of the blood vessels are muscle. And this muscle can get tense. And I want you to see the fibers of this muscle closing down. And high blood pressure can cause the thickening of the muscles of the walls of our heart or our blood vessels by it being high. So we thicken the muscle. And we can do things to relax the muscle by changing our baroreceptors inside the blood vessel wall. So we can cause vasodilation, and you can see it open up here like a spring, or constriction as it comes back down. So we're going to introduce you to something called Respirate. You can go to respirate.com. This is an FDA-approved biofeedback device. Here's our little guy, and you're going to see in the image here, he's drawn out, and he's going to have a device over his respiratory, which is right over his lungs, and he's listening to a machine that's telling him how to breathe. And he does this 45 minutes a week. And within 15 minutes a day, 3 times a week, 45 minutes a week, within the first month, blood pressure goes down naturally. Isn't that beautiful? And it's using respiration to relax that blood vessel wall and improving that. In addition to that, we have some nutritional things, as you'll get a better look at, like our ultra pressure control, which will help you give the body the nutrition to help maintain healthy pressure in the body, okay? That's another thing that you can use. But this Respirate is fantastic because it helps to relax the muscle. And whether the cause is primary or secondary to high blood pressure, this is a great tool to naturally impact your blood pressure. Now, don't stop your medication, but you can begin using this and then visit your doctor as you start feeling better, because you may have a need to decrease your blood pressure medicine under the supervision of a doctor. Thank you for joining me at the Envita whiteboard. Blood pressure can be overcome naturally, and I love saying that to you because when I was in medical school, they told me right away that there's nothing you can do. Once you have blood pressure, you have it for life. Well, I've got news for you. Lose your weight, get yourself the Respirate, and use the right nutritional supplements that we provide, and you can see a big difference in your blood pressure. Thank you for joining me at the Envita whiteboard.